Okay, picture this. A tiny newborn foal, just trying to stand on those wobbly legs. They have almost no energy reserves. Their metabolism is incredibly fast. And honestly, they're living right on the edge. Without the right nutrition, they go downhill so quickly. We're talking hours, not days.
Yeah, hours before things like severe dehydration or really dangerous low blood sugar can set. It's quite dramatic.
Absolutely. So today we're doing a deep dive into how vets actually manage this. We're looking at neonatal foal nutrition, specifically how they create this kind of nutritional bridge when a foal just can't nurse from its mother naturally.
Exactly. And our mission here is to really explore the two main strategies vets use. These are often lifesavers. We're talking about enteral and parenteral feeding. We'll dig into what makes them different, when you'd use one versus the other, how they're actually administered, which is meticulous work, and all the crucial care that goes into supporting these incredibly vulnerable little lives. We've got some great sources that really shed light on the details, the nitty-gritty of how these foals get the support they need. The aim is to give you a really solid understanding of this specialized area of veterinary care.
It's honestly sobering when you hear that stat declining in just hours without food. Our sources really drive home just how tiny those energy reserves are, combined with that super fast metabolism.
And that makes them incredibly prone to hypoglycemia.
That dangerous drop in blood sugar.
Exactly. And profound windness, even hypothermia if they don't get nutrition quickly.
Yeah.
Think about it. A healthy foal needs to drink, 15 to 25% of its body weight in milk every day. And they should be gaining 1 to 3 pounds daily. That's a huge amount of fuel for such a small animal.
So why wouldn't a foal nurse? I mean, what are the reasons?
Well, the causes can be really varied. It could be something systemic, like sepsis, that's a severe infection throughout the body, or maybe musculoskeletal problems that physically stop them standing up, or even neurological issues that affect their suckle reflex.
Right.
And if a foal can't nurse, you very quickly see that hypoglycemia we mentioned, and also hemoconcentration.
Chemoconcentration, meaning their blood gets thicker.
Yeah, essentially, because they're losing fluid rapidly and not taking any in. Their basic nutritional needs are complex to protein, especially specific amino acids like lysine, carbs like lactose, fats, essential fatty acids, vitamins, minerals, the whole package.
So, faced with this immediate crisis, what's the first thing a vet thinks? What's the strategy?
Well, our sources highlight a really powerful guiding principle. If the gut works, use it.
Ah, okay. That makes sense.
And that points us directly towards enteral nutrition.
Enteral. Right. What exactly does that involve, and why is it the go-to if possible?
So enteral nutrition basically means delivering nutrients directly into the GI tract. That could be orally, but more often for sick foals, it's through a feeding tube. It's absolutely the preferred way, the most physiological way, whenever the foal's gut is actually functional, even if it's only partially working.
Right.
And it's not just about getting calories in. Using the gut actually helps maintain its integrity. It prevents something called villus atrophy.
What is?
Basically, the delicate lining of the intestine, the part that absorbs nutrients, starts to shrink and lose function if it's not used. Enteral feeding also supports a healthy gut microbiome, so lots of benefits beyond just the nutrition itself.
Keeps the gut active to keep it healthy. That totally clicks. So when would a vet specifically choose enteral feeding? What are the scenarios?
Well, it's indicated for foals that have a poor suckle reflex, or maybe none at all. This could be due to conditions like neonatal maladjustment syndrome, dummy foal syndrome, some call it.
Right, where they seem confused or don't adapt well.
Exactly. Or it could just be severe weakness or prematurity. It's also key for foals that are anorexic, not wanting to eat because of illness, but, crucially, still have a working gut. Or sometimes foals have orthopedic issues, like contracted tendons that stop them standing up to nurse.
Okay.
And even if they can't get all their calories this way, giving small amounts in tertially, sometimes called trophic feedings, is still really important just to maintain that gut health we talked about.
Trophic feedings, like a little trickle charge, keep the gut engine running. I like that. But what if the gut isn't working? When would enteral feeding actually be the wrong move? Or even dangerous?
Yeah, good question. That's when you run into situations like severe gastrointestinal problems. Think enterocolitis, which is severe inflammation of the intestines, or something called ileus.
Ileus.
That's where the normal muscle contractions of the gut just stop. Everything grinds to a halt. Also, if there's a physical blockage or severe problems absorbing nutrients or just really significant inflammation, Trying to force feed into that situation could make things much worse.
Hmm?
It could even lead to complications like aspiration.
Okay, that makes sense. So, assuming the gut is working and they go with enteral feeding, what do they actually feed them? Mare's milk seems obvious, right?
Mare's milk is definitely the gold standard, yes. If the foal can't nurse directly, you can milk the mare and feed that milk via a tube or sometimes even a bucket.
And if the mare's milk isn't available?
Then donor mare's milk, perhaps from a milk bank, is an excellent second choice. After that, you're looking at commercial foal milk replacers. These are specially formulated, but you have to be really careful with mixing them. Proper dilution is critical.
Why is that?
Because if it's too concentrated, it can cause problems like diarrhea or even hypernatremia that's dangerously high sodium levels. Actually, our sources suggest diluting replacer maybe 25% more than the manufacturer recommends, just to be safe and avoid those issues.
Interesting. Any other options in a pinch?
Well, in an emergency, cow's milk or goat's milk can be used temporarily, but their composition is different fat and sugar content, so they might cause diarrhea or constipation. Sometimes they need extra dilution or even dextrose added. And if a foal happens to be lactose intolerant, you could use lactose-free cow's milk.
Okay, quite a few options then. How do they physically get the milk into these little guys? I imagine it's not always easy.
No, it requires skill and patience.
Yeah.
There are a few methods. Bottle feeding is possible, but only if the foal actually has a decent suckle reflex, but maybe just can't find the udder or latch on properly.
But it sounds risky.
It is. It's very labor intensive, and there's a significant risk of aspiration pneumonia, especially if the foal is weak or debilitated. You have to be so careful.
Okay, what else?
Surprisingly, syringe feeding, squirting it in should never be done. The risk of aspiration is just way too high, and it's hard to give enough volume anyway.
Right, avoid the syringe. Got it.
Bucket feeding is another option. It's less work than bottle feeding and actually lowers the aspiration risk and some potential behavioral issues you get with bottles, but some foals can be slow to figure it out.
So that leaves tube feeding. That must be the most common, especially for the really sick ones you mentioned.
Absolutely. Nasogastric tube feeding, an NG tube, is the most common and generally the most effective method for sick foals that can't nurse. They use a soft, pliable feeding tube, often quite small in diameter. It can actually stay in place for several days, and foals usually tolerate it pretty well.
But you have to be sure it's in the right place, right? Not in the lungs.
Critically important, before every single feeding, placement must be confirmed. You can do that by feeling for it in the neck, sometimes using endoscopy or even x-rays. And you also need to aspirate, meaning gently pull back on a syringe attached to the tube.
To check for what?
To see if there's any stomach contents or reflux coming back up. If you get a significant amount back, say more than about 50 milliliters, you should actually skip that feeding.
Why skip it?
To prevent overfilling the stomach, which could lead to dangerous regurgitation and aspiration into the lungs. You also always want to feed the foal either standing up or resting on its chest, its sternum, with its head held higher than its stomach. Again, all to minimize that aspiration risk.
Makes sense. What of the schedule? How much? How often? Sounds like a tricky balance.
It is. For sick foals, you usually start conservatively, maybe 5 to 10% of their body weight per day total, divided into frequent small feedings.
How frequent?
Typically every 1 to 2 hours, especially at the beginning. Then, as the foal tolerates it, you can gradually increase the volume and maybe space out the feedings a bit, aiming for that target of 20 to 25% of body weight per day.
And the tube itself.
The NG tubes can often stay in place for about 5 to 7 days. They need daily checks, making sure they're clean, and flushing with warm water before feeding to stop them getting clogged. If a foal needs feeding support for longer than that, sometimes a more permanent tube, called an esophagostomy tube, can be surgically placed.
Esophagostomy.
Yeah, it goes directly into the esophagus through the side of the neck. It bypasses the nose and throat, so less irritation, and it further reduces that aspiration risk for long-term feeding.
Okay, so that covers enteral nutrition, feeding the gut when you can, but you mentioned cases where the gut just isn't an option, maybe severe illness or after surgery. That must be when the other approach comes in.
Exactly. That's where parenteral nutrition, or PN, becomes essential.
Parenteral nutrition, also called IV feeding.
That's right, intravenous feeding. It provides all the necessary nutrients directly into the foal's bloodstream, completely bypassing the gastrointestinal tract.
And when is that the necessary route?
Well, it's indicated when the foal absolutely cannot tolerate anything going into its gut. So severe GI disease like that enterocolitis or ileus we talked about, or maybe after complex colic surgery where the gut needs complete rest. It's also used for foals with severe malabsorption problems, or just when they can't get enough calories enterally for a prolonged period, perhaps during a really bad systemic infection like sepsis.
What's actually in those IV bags? It can't just be saline, surely.
Oh no, it's far, far more complex. It has to be precisely formulated. What we call total parenteral nutrition, or TPN, contains dextrose for carbohydrates, amino acids for protein, and a lipid emulsion for fats.
Fats intravenously.
Yes, special fat emulsions designed for IV use. And then added to that is a very precise mix of electrolytes, sodium, potassium chloride, etc., and multivitamins.
Wow.
Sometimes they might use partial parenteral nutrition, or PPN, which might just be dextrose and amino acids in a balanced electrolyte solution without the fats. But here's something really crucial, and maybe a bit counterintuitive. While a healthy growing foal needs a lot of calories, maybe 120, 140 kilocalories per kilogram per day, a critically ill foal's actual energy needs, its resting energy requirement, might be significantly lower, sometimes only around 50 kilocalories per kilogram per day.
Really? You'd think they'd need more energy when they're sick.
You would, but their metabolism might actually slow down in some critical states. And overfeeding calories intravenously isn't just wasteful, it can be actively harmful. It can lead to hyperglycemia, dangerously high blood sugar.
So less can be more, in a way.
It highlights the incredible precision needed in calculating these PN solutions. It's not guesswork at all.
So how do they administer it? If it's going straight into the blood, I imagine that requires extreme care.
It absolutely does. You need a dedicated IV catheter, usually placed in one of the large jugular veins in the neck, and it must be placed using strict sterile technique to prevent infection.
Dedicated meaning only for the PN.
Yes. Especially for total PN, which is very concentrated hypertonic, we call it. It could irritate smaller veins, so a central line in the jugular is preferred. And that catheter line should ideally be used only for the PN infusion. No medications, no blood sampling through that line if you can possibly avoid it, all to minimize infection risk.
And how does it go in? Just gravity drip?
No. The PN solution itself is given as a continuous rate infusion, or CRI, using a very accurate fluid pump. This ensures a constant, controlled delivery rate. You don't want sudden peaks or troughs in nutrient levels, especially blood sugar.
And like with the tube feeding, do they start slowly with PN too?
Yes, very much the same principle. You typically start the PN infusion slowly, maybe at about 25% of the final calculated target rate. Then you gradually increase it to the full rate over about 24 hours, but only if the foal's blood glucose level stays stable.
What if it doesn't? What if they get that hyperglycemia you mentioned?
If the foal's blood sugar starts to climb too high, the PN infusion rate has to be decreased immediately. Sometimes they might even need to administer insulin temporarily to help manage the high glucose level.
And stopping PN, is that gradual too?
Yes, absolutely. When it's time to discontinue PN, the foal is weaned off gradually, usually over 12 to 24 hours. This prevents a sudden rebound drop in blood sugar, which could also be dangerous.
And all this time, sterility is key.
Paramount. Strict aseptic technique is vital during the mixing or compounding of the PN solution, which is often done in a pharmacy under sterile conditions and during every step of the administration. These solutions are incredibly rich in nutrients, making them a perfect breeding ground for bacteria if contamination occurs.
Makes sense. What are the biggest risks or potential complications with feeding directly into the vein like this?
Well, the most serious, without doubt, is catheter-related problems. Sepsis, a bloodstream infection starting at the catheter, is a major concern, or thrombophlebitis. Inflammation and clotting in the vein around the catheter site often link to infection or irritation from the catheter or the solution. That's why the sterile technique and constant monitoring of the catheter site are so utterly critical.
Okay, infection is number one. What else?
You can also see metabolic problems if the formulation isn't quite right or if the foal's condition changes. Things like that hyperglycemia we discussed, or maybe high levels of fats in the blood, or electrolyte imbalances, sodium, potassium, phosphorus imbalances can occur. And if PN is used for a very long time, it can sometimes lead to liver dysfunction. Plus, because the gut isn't being used at all.
Right, the use it or lose it idea again.
Exactly. You risk reduced gut motility, that ileus or the villus atrophy we mentioned earlier, and that can actually make it harder to reintroduce enteral feeding later on when the foal gets better.
That's a really important point. So PN is amazing, life-saving, but it's a highly managed support system, not without its own set of challenges. This whole thing, both enteral and parenteral, sounds incredibly demanding. Constant watching.
It really is. You're doing daily weights, sometimes twice daily to make sure the foal is gaining appropriately, aiming for that 1 to 1.5 kilos per day, ideally. Blood glucose needs checking frequently, maybe every 2 to 4 hours when starting TN, then maybe less often if stable. Electrolytes need monitoring, usually every 24 to 48 hours. The IV catheter site needs constant inspection for any hint of redness, swelling, heat, or discharge.
Wow.
And just imagine, trying to gently pass a tube or manage an IV line on a potentially wiggly, sick foal every hour or two around the clock. It takes immense precision, patience, and dedication from the veterinary team.
No kidding. So boiling it all down, how do vets make that crucial decision? Enteral, parenteral, or maybe even a mix of both?
Well, the primary rule, as we said right at the start, is always that principle. If the gut works, use it.
Yeah.
So enteral feeding is always preferred if the GI tract is functional, even partially, because it maintains gut health. Beyond that, the decision really depends on the specific illness and how severe it is, how long they anticipate needing nutritional support, sometimes, frankly, the owner's financial constraints.
Because PN sounds expensive.
It is significantly more expensive, yes. It requires intensive 24-hour nursing care, specialized fluids, pumps, frequent lab tests. So the available resources and staffing are definitely a factor too.
So it's a complex calculation based on the foal's specific needs and the circumstances.
Precisely. And often you might use a combination, maybe partial parenteral nutrition to provide baseline calories while slowly introducing small enteral feedings to keep the gut stimulated.
Okay, so the ultimate goal isn't just keeping them alive, is it? It's about getting them back to nursing from the mare. That bridge idea seems really central here.
Absolutely, that's the perfect word for it. The whole point of supplemental nutrition, whether it's through a tube or an IV line, is to act as that temporary bridge. It supports them until they are strong enough or recovered enough to go back to nursing from their dam. Even while a foal is getting tube-fed or IV nutrition, it's really important to keep allowing contact with the mare if possible. That helps maintain the bond and facilitates that eventual transition back to natural nursing.
How long might that bridge need to be?
It varies hugely. A foal with fairly straightforward diarrhea might only need PN for 24 hours to rest the gut and might feel much better quickly. But a foal with severe sepsis or after major surgery might need support for many days, maybe even a week or more. It's always a dynamic plan. The vets are constantly reassessing the foal's condition, adjusting the nutritional plan, always with that end goal in mind, getting them back to the mare. So as you can really appreciate, I think both enteral and parenteral nutrition are incredibly specialized techniques. They're often life-saving, truly, for these foals, and they just showcase the amazing level of precision, the dedication, the sophisticated care that's possible in veterinary medicine today, especially for these incredibly fragile newborns.
It really is an amazing blend, isn't it? High-level science, incredibly detailed monitoring, but also just deep, compassionate care needed to pull these young animals through. And I keep coming back to that bridge idea. It's powerful how all these complex interventions are fundamentally about restoring that natural connection, getting the foal back to its mother, back to thriving naturally. Just think about the sheer dedication to detail required to navigate these challenges, to save and support these incredibly vulnerable lives. And maybe understanding the razor-thin margins these foals operate on and the sophisticated ways we've learned to sustain them. Perhaps that gives us a new appreciation for the complexities of neonatal care across all species, including humans. Or deeper insights about recovery, about resilience, about sustaining life itself. Does this deep dive maybe spark for you something to think about?